At the concussion clinic on the south side, Mickey Collins, Mark Lovell, myself, and other people, we see 10,000 new kids with concussions or post-concussion syndrome a year. About a third of these girls and boys who come to the clinic have had CAT scans. Do you know how many positive CAT scans that I've seen in the last 5 years? 0. I've seen none in these post-concussion syndrome. That's like 15,000 CAT scans that were done primarily in defensive medicine in terms of ruling out something. So this device, in the same at the professional level, when I have an athlete at an NFL game that has a concussion, we're always concerned that they don't develop a problem later and they don't have an intracranial hemorrhage or hematoma. So we're very careful. The same way, if there's any question, we send them to the ER for a CAT scan. Well, with this device, I've been able to use this whenever I've had any questions of a possible problem. I scan them myself, and it's a very reassuring thing to know that at this point in time, there's no development, there's no evidence of an intracranial hematoma. It's not a complete substitute for a CAT scan if your suspicion is high and if you have any neurological symptoms or signs. If there's nausea, vomiting, severe headache, any visual abnormalities, pupillary inequality, yes, you go right to the hospital for CAT scan. But it's very unusual to have that happen. And you can have subtle, you don't have to be hit by a PAT bus to develop an intracranial hematoma. And you can have subtle findings. And to be able to use this repetitively without any radiation is a very positive thing. In the locker room, if there's a suspicion of a possible intracranial problem, it's such a benign thing, it's easy to use, it takes 2 to 3 minutes.
I think it's a tool that has not been present in the past for us to be able to use. It's going to provide another level of care for our student athletes as well as our students during the academic day. We envision this to be used as a tool through the triage and assessment protocols that we have in place. It's an opportunity again for our coaches, our parents, and our school administration to have a peace of mind that there's another tool and a device to help us with the assessment and triage of student athletes as well as students throughout the school day. I think as a parent myself and student athletes, I think it provides a level of care that really is right at the sideline of the court or immediately available to help assess and triage their needs. It gets an opportunity for a quicker evaluation. My son or daughter are injured and we have to use a tool, then I know as a parent that right then and there I have a level of comfort that before they leave the field or the gym for the night, that we have a baseline of what they're looking at, and there's an opportunity that if we need to go to the next round of medical evaluations, at least we have that to go into and say, this device showed up negative or it showed up positive. If it shows up positive, obviously, we're going to make a trip to the appropriate medical care facility. But again, as a parent, and I've talked to other parents, and they're very excited about the fact that we have this, because again, it's peace of mind for them, so that they're not guessing and they're not worried about what's happening. And I think overall it's going to be a benefit for our families.
My name is Matthew Treves, and I'm the head athletic trainer in the West Allegheny School District. The InfraScanner is very useful in guiding care and giving you that extra layer of care for the athlete that might have a subdural hematoma. So if you use the InfraScanner and it says that they don't have a subdural, or you use the InfraScanner and you feel that they do, it just helps to kind of guide the athlete to the correct care. Being the first high school to use the InfraScanner, it's very useful. You always want to kind of be a step ahead when it comes to the health care of the athletes and even just the general student population here. I actually had a student that had a subdural hematoma. He was a junior football player. It happened during practice, and this athlete took a hard hit, was kind of dazed, but didn't tell anybody, and then just kept hitting and kept hitting. The athlete went in to the locker room to get changed, actually collapsed in the locker room. I said, what's going on? And he was awake and conscious, and he was just saying, he goes, My left eye is blurry and my right leg feels weird. And so I start kind of going through my protocols and trying to figure out what exactly is going on. Ask him if neck pain, headaches. He goes, my whole body just hurts. We immediately contacted EMS and got that process started. He was sent by ambulance to a local hospital. They did a CT there, which showed that they did have a little bit of a subdural hematoma. They then transferred him to Children's Hospital in Pittsburgh, and they did a second CT scan there. The InfraScanner would have been very useful in that situation because it could have helped us to guide care and help to give us that extra layer of care. Instead of sending him to that basic hospital initially, we could have sent him right to like a trauma center. And the other thing is they had to do 2 CTs, where they did the initial CT at the one hospital, and then once they did this to Children's, they did a second CT, where maybe they could have just had to have done the one and just kind of monitored the symptoms. So they did kind of get a second dose of radiation. The InfraScanner would have been very useful to speed up the process and to send the kid to the correct hospital the first time.